then transition from TZ, so B to C, scapulothoracic joint right here, we're tilted back, we're posteriorly tilted, got a little inferior glide going on, some upward rotation to create some space and to prevent impingement of the subacromial arch right here. Got this medial glide and this retraction of the scapula with that upward rotation kind of coupled, that kind of econcentric kind of thing going on there, so that as we propel to home plate before TZ2, we get this great upward rotation, this thrust into anterior rotation, this lateral kind of translation and glide with this kind of this protraction. And so this will bring us to another point in terms of that TZ2, or that type 2 taking place on the opposite side of the body. It's then important also, I'll go through a cervical spine matrix, and I'll take a look at my relative left rotation of the cervical spine so that I can pinpoint, all right, is there potentially something going on at the cervical spine? So cervical spine motion-wise, if I want to look at my left and my right rotation right here, I have relative right rotation as I use this posterior lateral lunge because thoracic spine is rotating left, head is fixated forward, but we get relative right rotation. Then I'll switch sides. I'll look symmetrically at both sides. I'll also, with my pendulum swings here, I'll go with my frontal plane lunges to take a look at my side bend throughout the cervical spine, and then also thoracic spine. Gaze is fixated forward, eyes forward and nice and level, and we're just going to switch sides and we'll take a look at that. I love the pendy swing, so besides getting them right into that TZ1B and C transformational zones, getting my hands in there for some FMR, I'll also just nice and easy go through just kind of my 3D pendy swing here. So I'm looking at my posterior and my anterior tilt, my inferior and my superior glide, inferior and superior glide, and then I'll take a look at my upward and downward rotation with a pivot lunge matrix. Boom and boom, and I'll get my hands in there to feel that. And again, my transverse plane pendy swing with my same side and opposite side rotation, and get my hands in on that scapula and feel how it's actually working. I'll take them through a series of the common and the uncommon in-sync, out-of-sync lawnmowers. Take a look at thoracic spine and C-spine motion relative to each other, and the ability of my opposite side of my contralateral arm, that ability to load the opposite side scapulothoracic joint, shoulder, and then also hip. So breakdown of TZ1A to TZ1B and C, thoracic spine, scapulothoracic joint, and the glenohumeral joint. Have fun playing with those, assessing and treating. The ground's hot in San Diego today because it's 100 degrees. Play around with those. Those are a little bit more condensed. Resort and refer kind of back to what we talked about in those transformational zones in previous episodes. Use those assessment/treatment tools. In one, I'll look a lot at the common uncommon lunge matrix with the common uncommon shoulder to overhead press matrix as well, to take a look at how the hips are moving in relation to the thoracic spine and scapulothoracic joint. I also will, with the thoracic spine, go through my thoracic spine matrix, type 1 and type 2 in sync and out of sync, specificity wise. For pitching a baseball, I'll stick with just my type 2 in sync and out of sync. I'll pre-position the transverse plane rotation, drive the frontal plane, and maybe add the sagittal plane to it. Oddly enough, closed kinetic chain like progressions will go to a wall to feed in, so the kinetic, or the closed kinetic chain progression of the chain reaction, the multi-joint approximation, compression congruency. Get your athlete on a wall and take a look at, if you can see me, let's go, I think you all can see me right here, but we'll go with the TZ1B and a C right here, because if we're having problems with a type 2 in sync and out of sync, you get somebody on a wall and you get this closed kinetic chain rocking, it's going to feed on in, and you're going to notice that symmetrically wise, comparing side to side with type 2 in sync and out of sync, which I always 100% do. Are you able to reproduce your pain? So I have a pain and a restriction that I'll ostracize as I go through these, as I compare one side to the other. Oddly enough, when we go to wall, a lot of that cleans up because we take advantage of the multi-joint approximation, compression, and congruency. Go to the wall, compare their throwing side and non-throwing side, TZ1B, and then go TZ1C. Take a look at your type 2 in sync and out of sync. Use some little dumbbells, some squishy med balls as resistance to go through those, whether it's the glove side arm, throwing arm, a combination of both. Play with those. Your athletes, you yourself personally, are going to maximize your genetic potential. I guarantee you, with that outlook on functional biomechanics of pitching mechanics.